In the present video, we're going to discuss erectile dysfunction therapy options. I've already talked about drugs, but if you're new here, if you enjoy what you see, please tell your friends about this channel. Encourage them to subscribe and give everyone a little more information on their urologic and sexual health. I want to thank Blue Chew in particular for supporting this video. The majority of my patients' inquiries concerning erectile dysfunction, which is described as the inability to have penetrating intercourse, and affects nearly half of men over the age of 52. Vascular disease is the main cause. Additionally, problems including excessive blood pressure, high cholesterol, and inactivity are included. 30 more are affected by diabetes. Most diabetic males will experience erectile dysfunction. As a matter of fact, having the condition itself triples your risk. That's because erectile dysfunction is more likely to develop as diabetes progresses. Diabetes damages vital penile nerves and blood flow, both of which must function properly. Another 15 erections are caused by medication, which includes the most popular prescription drugs. Those that are known as thiazide or beta blockers, such as metoprolol, which is frequently recommended for depression, for blood pressure SSRIs, or serotonin selective reuptake inhibitors, in particular, frequently interfere with erections and smaller sexual functions. Neurologic factors, more especially those that influence the nervous system, are among the causes of erectile dysfunction. This covers multiple sclerosis, spinal cord damage, and other neurologic diseases. 5% more is attributable to pelvic problems like prostatectomy and other surgical procedures. Finally, a very small fraction is found in the lower abdomen, where the nerves leading to the penis run. Hormonal factors, including insufficient testosterone, account for about 3% of the population. Low thyroid function or pituitary problems, though, if you have erectile dysfunction, consult a urologist and your primary care physician. Your primary care physician should check you specifically for cardiac disease risk factors because erectile dysfunction can be. Check out my video where I discuss heart attacks, which are the first indication of heart illness. Erections can be the first indication of heart problems when you visit your doctor, as I've previously discussed. They'll ask you a ton of questions and take your history. Inquiries regarding your history with erections, including if they have come on suddenly or gradually. If you've recently experienced any trauma, we'll also acquire an early morning testosterone test along with a physical examination, or really any other physical issues that might be contributing. In order to rule out hormonal issues like insufficient testosterone, you should have a blood test done. We can eliminate things like psychogenic causes or problems that may be connected to your beliefs about performance anxiety from the history and physical examination. A sexual therapist or psychologist is the finest professional to treat erectile dysfunction. A penile Doppler test, which examines the blood flow to the penis, is another examination that some people might recommend. However, it rarely results in a change of management. But it does allow us to reassure individuals who could be experiencing psychological causes of erectile dysfunction. And most frequently, it's utilized to locate areas that may have developed an abnormality, known as an anomaly, in young men who have experienced some form of trauma and have suddenly suffered erectile dysfunction. There isn't a lot of other diagnostic tests because of the arteriovenous fistula. This is due to the fact that, unless you've experienced a trauma, the treatment is practically always the same. However, you can benefit from a highly specific operation, which is really uncommon in comparison to the treatment as I described. So, starting with a change in lifestyle, what can you do in the interim? Therefore, anything that is good for your heart will also be excellent for your erections if you're considering how to increase them. The Mediterranean diet, which emphasizes fresh foods, is the dietary shift that has received the most research. Avoid polyunsaturated oils like olive oil and processed meals like salmon. Having a Mediterranean diet has been demonstrated to enhance erectile dysfunction and delay the pace of deterioration in sexual function. All that comes in a box are basically saturated fats like dairy and red meat. Exercise is an excellent strategy to assist enhance erections, according to numerous research. Ideally, you should strive to exercise for 60 minutes 3 times per week. You can now do that. You can work for as long as you like in increments of 10 minutes each morning, afternoon, and evening. It doesn't have to be a big thing, and you can do it over the course of the next 7 days. If you take some of the medications that could cause this, it doesn't have to happen all at once. You can consult your physician about trying to switch to either another hypertensive medication for high blood pressure or another medication for high blood pressure from the list that we'll put up right here. Not to mention, if you smoke, just quit. Regularly consuming alcohol won't improve your erections, so avoid doing so. Try to drastically reduce or limit it on a regular basis, that is, every day with considerable amounts. Many of you have asked about vitamins and herbal remedies that may be helpful, but there are some serious problems with them. Here's one whose specifics we don't know. How are the supplements made? The contents and dosages are indicated on the bottle, but they are not controlled. It might not be what is on the supplement, and occasionally they are even tainted with other substances. The drugs tadalafil and sildenafil, as well as heavy metals, are already used to treat erectile dysfunction. The placebo effect, which occurs when you take a drug believing it will increase your erections, is surprisingly common in studies of erectile dysfunction. We do randomized controlled trials for this reason, because when you take something and believe it would increase your erections, which it actually does by up to 30%, therefore when you see people claiming to have used these, well, the placebo effect might be at blame for a lot of it. Now for the medical care. Go watch that video where I discuss how our bodies make erections, because I covered a lot about medical treatment in it. I can't take tablets if you detest going to the doctor or are unsure of how these erection improving drugs function. You have a Bluetooth option that is quite practical. It's a full service. It's so simple. You start by completing an online medical form, and within 2 right away, after the Blue Chew team has evaluated it, you are connected to a licensed medical practitioner. If you are eligible for pharmaceutical therapy, specifically formulated chewable sildenafil and tadalafil will be prescribed to you. These are created by specialized compounding pharmacies with licenses and sent directly to your door in covered packaging. And in the same manner, it can be delivered to your door for as little as once every month. South Carolina and North Dakota are the only states where Blue Chew isn't available, and they also offer excellent 24-hour customer support if you're interested. Check out the link in the following description and outside if you're interested in trying Blue Chew. There, you may receive a free 1-month trial of the medication in exchange for $20 off your first prescription. There are also additional drug choices that can assist manage erections, and I'm going to discuss a couple of them in this video. An intraurethral suppository is the first. This uses a drug called prostaglandin, which diffuses when inserted into the urethra. This improves the urethra's capacity to enter the penis's erectile or corporal tissues. In essence, it raises the smooth muscle, which is quite comparable to the cyclic adenosine monophosphate that I discussed in my previous video regarding sildenafil and tadalafil. Erections might persist longer when the penis is relaxed. From 125 micrograms to 1,000 micrograms, there are different dosages available. It is advised that you urinate prior to administering it. After inserting it into the urethra, stand up and massage the penis to help the agent enter the tissues. 32% of persons get penile difficulties as a result of this. A very tiny number, about 2%, will develop dizziness as a result of this prescription. 12% complain of mild searing sensation in the urethra, 5 to 6% complain of little bleeding or pain, testicular pain, or their female partners may have some vaginal discomfort. Last but not least, make sure you don't use this if your partner is expecting, because the prostaglandin in the medicine can transfer to your partner and trigger early labor. This could cause a reduction in blood pressure. A vacuum erection device is an additional choice, so I'll create a special. If you have used one before, please share your experience in the comments below. I'll make a film on this later. The intracavernosal injection is the final non-surgical alternative, but it worked for you. Which are? This is likely the most efficient treatment for erectile dysfunction, and it often involves a combination of 1-2. Yes, these 3 pharmacologic substances are each injected into the penis directly. The needle is so little, and frequently after administering the injection, patients would actually turn to face me and say, "Oh, that's it." Since that's all it was, it's not really as. Since you are obviously injecting something into your penis, it is as terrifying as it sounds. However, it works incredibly effectively and does so by relaxing the smooth muscle in the penis. They aid to boost erections by increasing blood flow to the penis, as I previously indicated. As I already stated, they come in 1 to 3 agents working together. Prostaglandin E1 is often a single agent among those. These have the same mode of action as the drug administered intraurethral. We just discussed a different substance or drug that is used in the. Papaverin is the name of the injectable, and because it uses the same mechanism as phosphodiesterase inhibitors like sildenafil, tadalafil, and others, it functions quite similarly to those drugs. It lacks specificity. Inhibits phosphodiesterase. The final ingredient is phenethylamine, which relaxes blood arteries to enhance blood flow. The substances are typically referred to as biomix when. We normally advise the first when they have 2 agents, or trimix when they have 3 agents. The dose is administered in the office so that you may learn how to administer it and assess your response. These have an extremely high level of efficacy. Up to 80 to 85% of folks will experience a reaction with this, as I previously said, although there are some adverse effects. 50 of the males who use prostaglandin E1, also known as Kava Reject or Edex in most cases as a brand name, will report using it. However, switching to a bi-mix or tri-mix formulation can alleviate some penile pain. 3% of those who receive the injection may experience some nodules on the penis. 2% of people who use it for longer than 18 months will get bruising and ecchymosis. The most dangerous side effect that we are concerned about is a hematoma, which is bleeding under the skin of the penis, which can occur in 3% of patients, and headaches or vertigo in 2% of patients. It's known as a priapism, or an erection that lasts longer than 4 hours, and I've discussed it previously. To learn more about priapism or what to do when you experience it, see some of my other films. If you've tried any or all of these methods, you'll eventually develop an erection that won't go away. There are more surgical choices available if you're still not having success. I've created a couple movies about them, so check those out for now. If you want a more in-depth video about the many types of penile prostheses, comment below and I'll make one. As usual, I'll also take care of myself because you deserve it. English.